Welcome back to Twin Cities Live. May is Mental Health Awareness Month, and Dr. Karin Ryan is a psychologist with Nystrom and Associates. She thought this would be a really great time for us to talk about a mental health diagnosis that is really often misunderstood. So Dr. Ryan is here with me in studio, and today we are talking about bipolar disorder. The National Institute of Mental Health says this impacts 2.8% of the U.S. population each year. But, you know, it seems like it's kind of often like the butt of a joke a little bit. You know, people use it as a punchline,
Yes.
or they'll have like a mood swing for whatever reason and then kind of go, oh, I'm bipolar. You know, that might be shifting a little bit, but let's talk
I think
about
you're right.
how many people are really impacted by this, and then we can break down, you know, some of the struggles that people might be facing if they're managing this.
Yeah, like you said, 2.8, you know, each year they're experiencing this. And so it's really recognizing it's not about mood swings or this 2-hour period of time or shifting within the day. There are distinct periods and episodes that qualify it as bipolar.
Okay, so it used to be called being manic depressive.
Yeah.
Is that like frowned upon now to say that, or is it just, it's just a shifting diagnosis?
Yeah, it's a shifting, I think, because it really helps it kind of understand what it is and how it is as a disorder.
Right.
And so it's having bipolar is when you have a full depressive episode, right? So a full depression is 2 weeks of feeling really down nearly every day or most day, right? That we've talked about that before. Decreased energy, decreased concentration, kind of feeling hopeless, feeling worthless, kind of not wanting to be alive sometimes, but just feeling really down.
Do a lot of the physical symptoms come along with that too? I mean, you know, those are a lot of emotional issues that you were describing.
That
like
heaviness, fatigue, exhaustion.
Headaches, maybe things like that. Okay.
Yeah, and so then with bipolar, you not only have the downs, the depressive episodes, you also have a manic or a hypomanic episode, which is a very clear, again, distinct period of time, 4 days to a week, of elevated mood, increased energy. Oftentimes people will speak more rapidly. You'll see more production or like starting more projects. And so it's a very clear, distinct period of time with this elevated mood.
Okay, but it's different of just going like, oh, I, you know, sometimes feel better, sometimes feel worse. I think, you know, and women kind of have different, like, I think mood swings depending on the time of their cycle too. This is much more distinct.
Yeah.
And this is interesting too, that you say that when you, during some of these manic episodes, that you don't need to sleep. People don't need to sleep.
Yeah, and so what you're highlighting is sometimes we have energy and we start a project, or sometimes we have energy, we stay up a little later. But what this is this pattern in a distinct period of time where there's that decreased need for sleep is one of the key things. That increased productivity, talking faster, sometimes flight of ideas. So what might start as kind of euphoric and this elevated, grandiose mood becomes quite overwhelming because thoughts are racing, you can't keep up, you start to get disorganized, and so it can be quite distressing to be in a full manic episode.
Yeah, so the manic can be just as troubling as the depressive.
Exactly.
Which might be one of the things, like misinformation.
100%.
Everybody thinks like the down part, and then you just are fine in the up part.
Exactly.
But neither like super high or super low is really great.
Right.
Okay, let's talk about getting an accurate diagnosis, because this has to be a little bit tricky. And do you start to see signs and then it gets progressively worse, or how does this operate?
Yeah, I don't know. I mean, it can get worse without treatment, but I think the main thing is it can come anytime. Anybody can start at any time, but there's the most common times when we see the onset of bipolar is anywhere between like 18 to 25.
Okay.
Early 20s. But certainly stress factors can bring it up, and there's a genetic component as well.
Okay.
And so it can be hard to get an accurate diagnosis, again, like you're saying, if some of those episodes aren't being fully recognized by the professional, or if that client doesn't totally recognize the pattern of it, it sometimes takes some time within therapy or within testing to kind of rule it out and figure out what are they experiencing.
Okay, so the diagnosis can be a little bit tricky. Do other people notice this about you, like, or do people notice it about themselves and figure out I need to get some help, or is it a combo?
I like that. It can be a combo, and I think one of the hard things is sometimes when people are in a hypomanic or a manic episode, it can be hard to recognize that in ourselves.
Yeah.
Right? Come up for anything, right?
Sure.
But especially this when there's this elevated mood and you start to feel great and you're on top of things and you're feeling like, oh, I can do this and I can do that. Sometimes there isn't that insider awareness. And so it does sometimes take that person to help get you that treatment or that care.
Okay, so if this can come on at any time, you know, how often are these episodes happening? Because you're saying like, okay, 2 weeks of maybe depressive and then 2 weeks of more in a manic state. Does that mean that's like consistent every single month, or is it a couple times a year?
Great question. It's really different for each person. And so without getting into too much detail, there is a thing called rapid cycling, but that's where you have 4 episodes, right, depression or mania within a year period of time. But it can really be, some people might have 1 manic episode and then have years without another one, and or have some depression, or have 4 depressive episodes throughout 10 years and then have a manic episode, or sometimes they kind of follow one another. So I think it's really important to recognize that it can look different, and the length of time between each and the severity can really vary as well.
Okay, so it sort of reminds me of like a little bit of if you have anyone that you love that has epilepsy, where it's like some people could be managing like many seizures, some people it's once a year or twice a year or something like that. So so then is it therapy and are there drug treatments? Is it a combination?
Yeah, I think what we find most helpful is because of the strong neurobiological aspect, it's really helpful to have medications. And so the typical treatment is a mood stabilizer. So one that helps kind of balance out, because sometimes if you try and just do a antidepressant, when you have bipolar, it can increase your likelihood of having a manic or a hypomanic episode.
Sure, and it would seem it probably wouldn't help the manic part.
So a mood stabilizer kind of helps find that middle ground. And then therapy is so helpful because what you'll find is people recognize their early warning signs. So one of my clients is like, as soon as she's like, oh, I don't need to go to bed yet. And another client, when she starts to get irritable at work, she's like, I need to check in. And so it helps. Then you're empowered. You know some of these warning signs, and you can really recognize it and curtail having a more significant episode.
Oh, for sure, because at least being a little bit emotionally prepared would help you kind of step away and recognize a little bit more.
Absolutely.
You know, what I think is really interesting is that I think sometimes if you have this type of diagnosis, or if you're struggling with something, you feel like, oh, people like me can't accomplish a lot, or I'm not going to be able to achieve my goals because I have this diagnosis. But there are some very big, super talented people
100%.
with bipolar. Like, I mean, you got a long list here. I mean, and it's not happy for them, but I also think it's like relatable that that you can see really amazing, talented, successful people. Catherine Zeta-Jones, Demi Lovato, Frank Sinatra, Mariah Carey, Renee Russo, Sting. Ted Turner, and Jean-Claude Van Damme.
Right.
That's amazing.
Yeah, and I think what's so helpful is more people, the more we talk about it and the more we normalize it, and this is just another mental health need. This isn't anything better or worse, it's just a mental health need. And when people then empower to recognize it and talk about it, then we can get an accurate diagnosis faster, we get treatment faster, we get support, we've got friends helping us watch out for signs, and we don't, it just makes all the difference.
That's
and so
fantastic.
You are not alone.
That's great. Dr. Ryan, we love having you here. Thank you so much. Nystrom and Associates provides care in the fields of psychiatry, psychology, family therapy, and more, and they have 20 locations in the Twin Cities. They are happy to work with couples, families, and people of all ages. So if you're struggling with any kind of stress, anxiety, depression, or addiction, make sure to reach out to them. They would be more than happy to help you.